step, passing health care, universal health care, with a strong public option. And I look at this crowd tonight. I look at the number of you here in this very hot, autumnal summer, whatever it's called. Watching the bus, we took this bus from about 100 yards away. Mike Coleman wanted me to tell you that we got on in Omaha and we've been riding all night. We actually got on, I think, over there. Anyway, but I look around at this. First of all, how many of you are union members? The thanks of all of us for building the middle class. And because you have a strong union, you generally have pretty decent health insurance. Yet you are here tonight. You don't really need to be here because you've already got health insurance. You're here tonight because of as Mayor Coleman talked about, the tens of thousands of people in Central Ohio that don't have health insurance. You're here tonight because every day, every single day in Ohio, 390 people a day in Ohio, 12,000 people a day in this country are losing their health insurance. That's why you're activists. That's why you're here. That's why you're showing your in spite of what the other side says, and in spite of the maybe 14 or 15 hecklers over there, not 14 or 1,500, 14 or 15, in spite of that, you are the real patriotic American. Now, you gave me the privilege of serving you in the United States Senate by being elected in 2006. And you also gave me a privilege that I got to know Ted Kennedy pretty well the last couple of years. And I wanted to tell you just one story. I don't want to stand up and tell a lot of stories about Ted Kennedy, but he had a little office, kind of living room office, not far from the floor of the United States Senate. And he had put me on the Health, Education, Labor, Pension Committee earlier in 2007. He had put me on as one of two freshmen he put on his committee. And I'll get to this in a minute, but he asked me and another member of my class, he and Chairman Dodd, who was filling in when Senator Kennedy was sick, he asked me to write up the language of the health care bill to establish the public option. Say I know because I helped write it, but I do know that the public option is going to work, and the public option is going to be part of the health insurance. Senator Kennedy used to invite me to this little office he had about right above the Senate, about 100 feet away from the third floor of the Senate chamber. He'd invite me and 2 or 3 or 4 other senators up there when we had late votes at night. And I remember one day going in there about 9 at night when we were waiting for other votes until about midnight that night. And I walked around this office he had, which was about half again as big as the stage, and I looked at the pictures on the wall. And these were pictures of people whom you know. I mean, people that history knows. These were pictures of Bobby Kennedy and Jack Kennedy, pictures of Ethel, pictures of Joe Kennedy, the oldest Kennedy, who, as all the Kennedys, were in the armed services and served this country. Joe was killed during World War II, as I think you know. And I saw pictures of them sailing and pictures of them in Hyannisport and all that, pictures of them in their offices in the White House, in the Senate, whatever. And these were pictures that I had never seen before because these were Ted Kennedy's family pictures. These weren't the pictures that were in Life magazine. But what struck me is the kind of life that Ted Kennedy could live and was living, and he didn't need to stay in public service for 47 years. He easily could have walked away. But you know, like Pastor Deemer, Ted Kennedy understands that progressive government and social justice and economic issues and health care are moral issues. And with Pastor Deemer, who happened to be, and I happen to say this, share the same faith as Lutherans, but as Pastor Deemer talked about, Senator Kennedy understood that part of his faith was the question of moral questions and the issue of equal justice and the issue of health care for all. That's why he never quit. That's why nobody in this crowd is quitting. That's why we're going to get health care with a strong public option. Because you have great speakers, progressives that are going to change this country, standing behind me that will speak. But I want to tell you one other broken story. I was in Cincinnati today, and I did one of those town hall meetings that you hear about. And you know, I can't count the number of people that said, "Don't do one in Cincinnati. Go to Cleveland, go to Youngstown, go to Columbus, go to Toledo, go to Akron, go anywhere, but don't go to conservative Republican Cincinnati." But you know, I'm not going to run from them, and you're not going to run from them. After going to Cincinnati today, more than anything, I wanted, my wife Connie is over here, many of you know Connie. Connie and I were riding back in the car, went to Dayton, and came over to Springfield and here. And we were talking about how great it would have been to call Ted Kennedy and tell him what happened in conservative Republican Cincinnati. Here's what happened. 1,400 people showed up at the University of Cincinnati to talk about health care. 1,400 people. Probably 300 or 400 were opposed to the bill. Most of the rest were supportive of the bill. But only of these 1,400 people, you've seen the television, you've seen the streaming, of these 1,400 people, only about 100 were rude and nasty and angry. Only about 100 out of 1,400. You know what? Those 1,400, those 100 people, they couldn't shut down our town hall meeting. And those 100 people aren't going to shut down our health care. And there was some, one guy, I'm sorry, I didn't go on. One guy stood up and he said, we're against big, they're against big government, right? Yeah. Even though they throw Medicare, they think Medicare's pretty good. They hate big government. Then one guy said, I trust the 1,300 insurance companies in this country to do it better than the public option. So I asked this crowd, I heard enough booing today, I don't need more booing. So I asked the crowd, I said, okay, which would you rather have? 1,300 private insurance companies, for-profit insurance companies, or Medicare? Which would you rather have? And guess what the crowd said? Now, one young woman, I want to tell you one more story. One young woman stood up. Okay, one more. This really is one more story. We had about 200 high school students from any of you from Cincinnati, Walnut Hills, and the Cincinnati Job Corps, and Wyoming City School District. We had 3 high school groups, about 200 kids. They were sitting in the front 3 rows. We saved those for the kids. They were the best behaved people in the whole auditorium. But of course they were. But one young lady, 17 years old, named Rachel, she had the guts to stand up. And she told this story. She said, I'm 17. I'm as healthy as I can imagine. Said, my father's side of the family carries the gene that often leads to breast cancer. My mother's side of the family has an autoimmune disease, has had several that have been afflicted with autoimmune disease. She said, I have a physical once a year, I'm perfectly healthy, but you know what? She said, because of her parents' illness, she was told by the insurance company she will never get health care because she has a pre-existing condition. If that's not a reason for the $40,000 or $50,000 in bills for their cancer. They get canceled because there was a cap on their insurance. You know why the insurance companies do that? You know why they have the pre-existing condition? You know why they discriminate? Because the CEO of Aetna makes $24 million. They got to find a way to pay him. Those days come October, November, December. No prediction of the date, just a prediction that it's going to happen. Come October or November or December, when people gather in the White House and President Obama signs the most important bill of our lifetimes, those days will be over for the American. Senator Kennedy's next oldest brother, Robert F. Kennedy, was speaking in South Africa in 1966. And I really will close with this. He said, looking out to a group of mostly black Africans, people who didn't have a lot of hope for the future, he said, each time a man stands up, Bobby Kennedy said, each time a man stands up for an ideal or acts to improve the lot of others, or strikes out against injustice, he sends forth a tiny ripple of hope. In crossing each other from a million centers of energy and daring, these ripples build a current that can sweep down the mightiest walls of oppression and resistance. You are the million ripples of hope. You're the reason we're going to get health care. It's starting tonight.